Assalamu alaikum. I am Dr. Sagia Afroz, Associate Professor, Department of Pharmacology, Bashundhara Ad-din Medical College. Today I am going to discuss an important topic named is biotransformation. It is a part of pharmacokinetics, and first of all I am going to tell the definition of biotransformation. It is the process for chemical alteration of the drug inside the body under the influence of biotransforming enzyme to make the drug suitable for its excretion. The organs of biotransformation. We know the major organ of biotransformation is liver. About 99% biotransformation occur in the liver, but the other organ involved in biotransformations. The other organs are kidney, lungs, gut mucosa, brain, plasma and skin. The consequences of drug metabolism. The important consequences are inactivation of the drug, changes the solubility of the drug, conversion of active drug to inactive drug, conversion of active drug to another active drug, conversion of inactive drug to a active drug, and active drug converted to the toxic metabolites. The enzymes for drug metabolism. Important enzymes that are involved in metabolism of the drug are mainly present in the smooth endoplasmic reticulum, but also present in mitochondria, lysosome, cytoplasm, plasma membrane and nuclear envelope. The types of metabolizing enzymes. Two types of metabolizing enzymes are involved in biotransformation. Number one is microsomal enzyme and number two is non-microsomal enzyme. Microsomal enzymes are mostly present in the smooth endoplasmic reticulum, and non-microsomal enzymes are mostly situated in the other sites such as the cell membrane, cytosol, lysosome, nuclear envelope, etc. The microsomal enzymes are cytochrome P450, NADPH, cytochrome P450 reductase, etc. and non-microsomal enzymes are transferase, monoamine oxidase, aldolase, amidase, esterase, etc. There are two phases of biotransformation. Number one is phase 1 and number 2 is phase 2. Phase 1 reactions are also called non-synthetic reaction and phase 2 reactions are also called synthetic reaction. Phase 1 reactions. In this reaction, there is introduction or unmasking of a functional group such as hydroxyl group, amine group, sulfhydryl group in the drug. The fate of drug after phase 1 reaction, make the drug more polar and less lipid soluble and suitable for phase 2 reaction. Loss of some activity of the drug and sometimes become toxic metabolites. The reactions occur in the phase 1 reactions are oxidation, reduction and hydrolysis. Oxidation is the most common and important reaction that is occur in the phase 1 reaction of the biotransformation. The enzymes involved called the mixed function oxidase, cytochrome P450, NADPH, cytochrome P450 reductase. Hydrolysis. In hydrolysis, drugs are hydrolyzed by esterase, amidase, peptidase, etc. Phase 2 reaction, also known as conjugation reaction, coupling of the drug or drug metabolites with an endogenous substance that are present in the body like glucuronic acid, sulfate, glutathione, etc. Phase 2 reaction needed transferase enzyme. Almost all types of reaction. Types of conjugation. There are several types of conjugation. Number 1, glucuronidation, acetylation, glutathione conjugation, methyl conjugation, glycine conjugation, sulfate conjugation, sulfhydryl conjugation, etc. The fates of drug after phase 2 reaction. All the drugs become inactive and drugs become water soluble and polar and easily excreted from the body. Now I am going to tell the enzyme induction. What is the definition of enzyme induction? There is increased synthesis of hepatic microsomal enzyme due to chronic use of certain drugs. This phenomenon is known as enzyme induction. increased amount of enzyme metabolizes the inducing drugs and also the other drugs. There are drugs which causes the enzyme induction like phenobarbital, phenytoin, rifampicin, phenoxybenzamine, glycofulvin, tobacco, alcohol, etc. Importance of enzyme induction. Number 1 is tolerance of the inducing drug, therapeutic failure develop and drug interaction if second drug is given. Drug interaction. The inducing drug and a second drug, if co-administered, the effect of second drug is decreased due to the more metabolism of the second drug leads to therapeutic failure of the second drug. As for example, if rifampicin is also administered with the oral contraceptive pill, then patient may conceive or there may be therapeutic failure of the oral contraceptive pill. Enzyme inhibition. What is enzyme inhibition? There is decreased synthesis of the hepatic macrosomal enzyme due to chronic use of certain drug. Here, increased effectiveness of the primary drug and increased toxic effect of the primary drug. The enzyme inhibitors are cimetidine, chloramphenicol, ciprofloxacin, antifungal azoles, metronidazole, erythromycin, disulfiram, allopurinol, etc. The importance of enzyme inhibition. There might be increased response of the second drug due to less metabolism, and cimetidine and propranolol are, if co-administered, there may be hypotension occur, and anti-diabetic drug and cimetidine if co-administered, there may be hypoglycemia. Now, Hoffman degradation. What is Hoffman degradation? Spontaneous biotransformation of a drug without any enzyme activity is called Hoffman degradation. Example of drug that undergo Hoffman degradation is atracurium. Thank you so much. That's all for today.